some of our regular guests here to talk about safety and health. We have Dr. Lynn Mitchell, the Chief Medical Officer of OU Physicians, and Dr. Cameron Mantor, the Acting Chief Medical Officer for OU Medicine Hospitals. So welcome and thanks for coming.
Thank you.
You know, we've talked a lot about how the COVID-19 pandemic has changed the sort of environment on campus and what those safety measures look like. And I wanted to just hear from you about how that's evolved over time, or if it's evolved since we started our back to care and kind of phased reopening plan of electives and what have you. What does that look like in the last month to 2 months at OU Physicians and in the hospitals?
I think you'll see a lot of things that you're starting to get familiar with, Jennifer, in that we're still screening individuals as they enter into one of our clinical areas. Everyone has a mask on and the appropriate mask on. I think the one kind of take home from all this is that while this virus is changing dynamically and there's new information coming out literally every day, I think what we're committed to is making sure that we stay up with that. So that if there are changes that need to take place, we want to make sure that we're on top of it. We make sure we implement that, and that we've always propelled, hopefully, the best, latest science to make sure that our clinical areas and our hospital areas are safe.
How about in the hospitals, Dr. Mantor?
Well, I think Lynn gave a great summary of what's going on. It is a very different day. You do see the new norm, which is everybody who's in the hospital has a mask on. At Children's, we are allowing a parent to come into the hospital, which is different than the adult side, which is still a real struggle for the adult patients, but we think it's still what's safest for our staff and our patients. But the new norm is everybody is doing what we think are the right things to protect themselves. We, over the past, 4 or 5 weeks, really did see a pretty large increase in number of positives within the community. Part of that was because of testing, but part of that was because more and more people were testing positive, and there were more true positives. But interesting, the last maybe 10 days, almost not quite 2 weeks, I think we are seeing somewhat of a decrease in number of positives and a little bit of a decrease in admissions for patients that are being positive with COVID as well. I think probably the biggest thing is that I think the staff and patients and families are becoming a little bit more comfortable with understanding what it is and what we're trying to do to try to protect patients and families, like the masking and the social distancing. It is a little bit of the new norm, like we talked about. Remember, there was so much resistance at first. Do I really need to wear a mask, and is it important? And I think that with the Oklahoma City mayor coming out, almost 3 weeks ago now, and our insistence at the hospital that we are going to do this, and that's an expectation. I think people are finally understanding and recognizing that this is the right thing for us to do.
You know, I know back in March when all of this started, we very quickly implemented universal masking on our campus. There was a lot of questions in the media and in the public around if a fabric mask helps, if a surgical mask helps, if it always should be an N95. But we kind of moved there quickly. How do you think masking has kind of played into the conversation in Oklahoma as far as decreased numbers and things that you've seen? Dr. Mitchell, what are some of your thoughts on that?
I think masking is key. If you could see my name tag, you'd see a button that says masking is a must. I think we know in the healthcare industry that masking has always been something that certain populations, such as individuals in the operating room, have done. There's a reason they do that. That protects others, because somebody is not allowed to expel as much through their mouth and their nose, just like we normally do now while we're talking. So we've always known that masking works, but now the thought that we're going to make that much more broad has been hard for some individuals to understand, but it's very clear. The science is very clear that masks work. Different masks work to different levels of efficiency, but masking is a must. And we have certainly implemented that early on, and now it's so nice and so helpful to see that some of our public figures have made that decision on behalf of some of our communities as well.
Now, we've talked before about how one of the things that we noticed here locally and nationally is people delaying care, maybe not going to the ER or not coming in for those screenings and visits. Tell me a little bit from a hospital perspective, are we seeing that that's still occurring? Are people coming in? We know that it's one of the safest places you can be, as you've discussed before. What does that look like now, Dr. Mantor?
So I would tell you that and would speak for the emergency room, our emergency room visits are not back to numbers that we saw back in January and February or last year. They are still depressed in numbers, but I think what we found is that it really is what we call the level 4 and the level 5 ED visits, which are patients that come to the emergency room, but very much could be seen in a physician's practice office as opposed to the emergency room. It's not a true what we would think of as an emergency. But from an operation perspective, from an inpatient perspective, I occasionally have a parent who has a concern and wants to know, is this something that we could put off that we have to do right now? But that's fairly uncommon. I think people are recognizing, I think we've gotten the word out that the hospital is a safe place, that we do have patients who we're treating for COVID, but it's the minority. The great majority of our patients are not patients who are sick with COVID, and that we're doing everything we need to. Lynn brought up a great comment about wearing the right mask. I think everybody in the community now understands what an N95 mask is. 6 months ago, nobody knew what that was unless you worked in construction or were a painter. But I think we have learned a lot about what do we need to wear to protect us and the patients. We are having a little bit of a struggle with people who come in, non-healthcare workers who were expecting to wear a mask, at children specifically, who think that wearing a bandana or a gaiter around their neck is really sufficient. And we're working through how do we message to them that really that's not healthy for them or for us. A new one that we've kind of come up with that we decided that is a problem. A lot of people have these masks that are N95 masks with a valve on them. And so that's probably very protective of the person who's wearing the mask, but that kind of a mask still allows for that person to expel respiratory droplets. And so that's a mask that we are clamping down on to say that that's not an acceptable mask. So wearing the right mask, I think, is really important. And as Lynn said, there's no question that we're convinced that the decrease in positives that we're seeing and admissions that we're seeing is the community is, I think, picking it up and recognizing, understanding that this is not a stigma. It's the new norm, and people are doing it.
Dr. Mitchell, in the clinic setting, are you seeing people coming in or delaying care? I know OU physicians very much transformatively went to virtual as far as platforms and accelerating our presence in the virtual space. We've been doing virtual visits before, but now there's, I think, 77 specialties. What does that look like in the clinic setting as far as patient engagement on coming in clinic, going on the virtual site, or if they're delaying care?
Absolutely. Our clinics are busy, which is great because the care that needs to be provided is being provided. The one caveat that would probably be the difference is if something can be handled through a virtual visit or is more appropriate to be handled through a virtual visit, and I'll give you an example of that. Maybe you're coming for a post-operative visit after you've had some surgery with a surgeon who performed that. A lot of that care can be provided virtually. We have patients all over the state. If someone can stay at home and have a virtual visit with their surgeon, not have to drive 2-3 longer hours to get here for what may be a very short, uncomplicated visit, that's something we can offer. So we're offering virtual visits essentially in all of our clinical areas if it's appropriate. If someone needs to be seen in person, we want to make sure that that's done and done safely. So we've got several different things that happen. We mentioned the screening. When you enter the clinic, everyone's in a mask. We screen for symptoms. And we've even got some of our clinics have areas where most of that is done in your car. so that you'll receive a call when it's your turn, per se. Someone will come to your car, make sure that you're in a mask, perform the screen in a mask, and then you'll be escorted in and not sit in the waiting room. You'll actually be escorted in and go right to one of our examination rooms, so that there's really no chance for you to be around a large number of individuals. We take all this very seriously, very, very seriously, and we're making sure that your ability to come in or be seen virtually is as easy as we can make that to be.
So one of the things that I think is on everybody's mind as, you know, we're moving through 2020, it feels like it's been a long year, but it feels like it's been a fast year, doesn't it? You know, school is either having started in some places, is going to be starting soon. What are we thinking about as a healthcare organization about what we think the next few weeks or a month may look like with the pandemic? And then thinking about it as we move into influenza season, what are some of those things we really want people to be thinking about?
That's the crystal ball question. I think everybody would like to know. I think we're all we're concerned for teachers. We're concerned for the kids in school. This is uncharted territory. I think that some schools are making different decisions than others to go completely virtual versus 2 days a week and a clean and 2 days a week. I think time is going to tell us how that's going to work. I think that as long as students and teachers proactively screen themselves, and you know, if I'm not well, then I shouldn't go. But if they aren't healthy and feel well and go to school and mask and you know, social distance as well as we can, then I think they're doing everything they can to obviate the furtherance of a problem with people getting sick.
So with influenza season coming, do we think that it's going to look different because everyone is masking? Does that help with something like influenza? And how does that, you know, how do I know in the fall, do I have influenza or do I have COVID? What does that look like, Dr. Mitchell?
That too is a great question, and one that we've got to consult with the crystal ball about. But certainly the flu, influenza, and COVID might present very similarly. And so we're working with our Department of Pathology and our laboratories to be able to appropriately test, so that perhaps we'll be able to do a test for both at the same time. So that's one thing that can happen. So we're really just in the throes of that right now. What we want to do is to make sure that we have an appropriate place to see those individuals with respiratory illnesses. We're working with some of our clinical areas, and I know Dr. Mantor is as well, on the children's side of things, to make sure that we have an appropriate place to have people come in, have that testing done, receive that care, have an evaluation to see what we're dealing with, treat it appropriately, and get then somebody back out and on their way. So all of those are ongoing discussions, but yet again, we're taking that very seriously to make sure that our patient population is not only appropriately, efficiently, and high quality cared for, but that's done in a manner that puts their minds at ease.
If I could make a pitch, I think even though we're all doing this, and I'm very interested to see what's going to happen, but I really would bet that we are going to see fewer cases of flu as compared to in years past. But I think everybody needs to still hear the message of please get a flu shot.
Yes.
Don't feel like this is gonna protect you. I think getting a flu shot is still gonna be an important part of that.
Right.
But I really do think that it is gonna make an impact on the number of cases that we do have. And Lynn mentioned the ability to have one specimen and do tests for both influenza and for COVID is something that will help us out a lot.
So this has been going on for a while, like I mentioned earlier, and I'm just wondering, you know, early on in the pandemic, nationwide, there was an outpouring for healthcare workers and healthcare heroes. As this continues and people try to get back to life and we're seeing more volume, we're managing COVID, how is the morale of our healthcare workers, and what are some things that we can be doing for them as a community?
I think the morale is good. I think it's hard to be in healthcare and not really feel like you're called to that, and you have the ability to make difference every day in someone's life. So, I mean, you're never looking for really the motivation. The motivation comes with the job, in my opinion. But also at the same time, we've done several things to make sure that our healthcare workers are caring for themselves. I put out a message pretty much every day, and it always usually ends with thanking them for all they're doing, but also admonishing them to care for themselves, not just for others. So we have had lectures. We have put out different apps that they could download on their phone. We've encouraged them to make sure they take time off. And we are constantly looking for ways to make sure that we care for each other. We had a lecture about a week and a half ago now where we had one of our psychologists talk about all the different things you can do to relieve stress. And we've encouraged that among our healthcare workers, including, he mentioned things like practicing just a couple of yoga stances, maybe when you brush your teeth or something like that. Just making sure that you're mindful that this is a very concerning time for all of us, but it's a time, and we're going to see the end of this as we approach the future.
There is a light at the end of the tunnel with all of the things going on around managing COVID, and I think that's probably an encouraging piece for all of us to see some of those news items coming out around vaccine research and things of that nature as well. So thanks for that reminder. If you could give the public maybe an important lesson, tip, words of hope that you maybe cling to or use thinking about COVID-19, what would that be for each of you?
I think probably one of the biggest is that we've learned a lot about how to care for patients who become infected with the virus. I think we've from the beginning of treating with quinine and all the stuff that went around with that. There are some medications that we currently use which truly seem to be working well, and so I think the biggest is that and the majority of the patients who become positive with the virus don't have to come into the hospital, and they go through the respiratory illness and they recover. But for those that do become ill enough to either be admitted to the hospital or get put on a ventilator, get critically ill, that we've learned a lot about how we can treat the virus and to get a good outcome for those patients. So I think that's a message that we would like for them to hear. And then the other is that they're doing yeoman's work for helping stop the spread of the virus. Okay. Both of those are biggies.
Dr. Mitchell?
And I would just build on what Dr. Mantor said. I think all of us have a certain sense of accountability right now that we need to make sure that we pay attention to. I think this is going to end. I think all of us, though, if we each do our own part, can really make that happen in a way that is responsible not only for ourselves and our own family, but to others as well. So I think that's important, and I would just wave that flag a little bit that not only are you caring for your own, make sure you're thinking about caring for your fellow citizens right now.
That is a great way to end today. I thank you both for taking the time and speaking to us about this important topic. We're going to be back here again next week. We have a lot of really exciting topics coming up. Keep direct messaging us and asking us those questions. We always shape these off of what you're interested in, and we will see you next time.